Good evening, everyone. As Archana kindly introduced me, I will not delve into anything that I'm doing further here. I did want to let you know that I lived in California for about 7 years or so. We're in Los Angeles. I was at USC at that point, and my wife, who is actually from India, I'm originally from Nepal. So my wife, who's originally from India, did her radiology residency while I was in charge of informatics at USC. She did her radiology residency there at USC, and then started her. Actually, no, finished her residency when we moved to Pittsburgh, and then did her fellowship in abdominal imaging at UPMC, where I was working there as well. So what I've titled my presentation today is just managing enterprise strategy amidst a crisis. And what I thought I'd do is just run you through some of how we as a large health system here in the Southeast are really thinking about some of the strategies related to COVID-19 and how we come out of this. It's pretty sobering if we look at the milestone that we hit April 28th, I believe, where in the United States we topped 1 million confirmed cases of COVID-19. And that's nearly a third of the world's cases. And right now, I think we're at about 1.3, if not higher already today. So what's uncanny is that we spend trillions on defense, yet it really wasn't a missile that brought down the world economy. So in many ways, COVID-19 should be an eye-opener for how we prioritize spending in public health. And one thing that has become apparent, and I think Anish might touch upon this as well, is that the walls between medicine, so this is where we all practice healthcare, and public health, the walls between those two domains have really come down as a result of COVID-19. And clearly, it's now more of a global pandemic, right? Something that started in Wuhan is affecting all of us all across the world. So geography really is, more of just a physical construct, and it's not an economic one anymore. So a lot of things I think will change. And in fact, the way we work, our business models, the very interaction with our patients will change, and they've already started to change from now on already. So lots of things going on. What I thought I'll do is I'll just quickly introduce Atrium Health and give you the context of the health system that I'm a part of. I'll talk about the current situation, and I'll talk a little bit about how we're trying to think through the elements of managing the strategy and how we're leading through the crisis. And I'll end with a couple of vignettes, talk about our COVID-19 virtual hospital and how that's going to lend itself to some newer care models. We just went live a couple of weeks ago with point-of-care ultrasound innovation that we took out a big press release actually just today. So we'll talk a little bit about that. And I'll end with some of the things that we're doing around communications and community engagement, which I think will dovetail nicely into Anisha's presentation. So Atrium Health, we're based out of the Southeast here, headquartered in Charlotte here in North Carolina, about 70,000 teammates. But then we're also in South Carolina and in Georgia. So a lot of things going on across the three states here around COVID-19. We're about 50 hospitals and about an $11 billion health system. So a lot of different numbers here. I won't go through everything. This was pre-COVID-19, where we had, in this volume-based way of practicing healthcare that we're all in, good volumes. What's really interesting about Atrium Health, and this is all volumes depicted in one day within 24 hours, like all close to 40,000 patient encounters, so one every 2 seconds. But what's really unique about Atrium Health is the community mission that we're on. This is one of the things that really excites me to be a part of the leadership team here and to lead strategy. So 2.2 $2 billion in uncompensated care and community benefits every year. And that's like 5.7 million in a span of 24 hours. So we do a lot of things for the communities to address social determinants of healthcare, the disparities in care. And in fact, if you look at the statistics across the Southeast here, there's a lot of disparities between the haves and the have-nots. And part of our mission at Atrium Health is really to solve for that, right? It is about health and hope and healing for all. And those last two words of our mission statement really resonates with a lot of the strategies that we've put in place. I've been here for about 15 months. And even in the last 15 months, been able to do a lot of things with the leadership team to push for the for all part of the mission statement. And that speaks also volumes of the continued strategies that we're putting in place post-COVID-19. So a couple of quick words about the current situation. We did manage to sort of flatten the curve. So we're expecting a big peak. It was meant to be in the middle of April, and we pushed it off to about the middle of May. And because of the stay-at-home restrictions and the shutdown and all of that, and lots of other things that we're able to do, we did manage to flatten the curve in large parts, and it's more of a plateau than anything else. You can see from just yesterday's numbers, however, that it's not going down. It continues to spike up or down, and so it is more of a plateau. And we're seeing that really across the three states here. Georgia has been hit especially hard, and the governor did decide to open up the tattoo parlors and the bars and all of the beaches and all of that. So we're expecting the spike to continue to go up in Georgia, and we'll see how things play out here in North Carolina now that the stay-at-home order has actually been lifted in a phase 1 approach as of May 8th. So a lot of things going on, but virtual health, this was a set of capabilities whose time had come. I talk about telemedicine as an overnight success story that was 30 years in the making, because we've been working on it. We've been pushing forward with telemedicine. I'm a radiologist, so teleradiology, and we've been doing this for decades now. But suddenly, because of COVID-19, you could see the numbers just spike up in so many different areas across the board. So really remarkable. And here at Atrium Health, we're seeing those numbers spike up as well. And you can see some of what I've represented there. It was interesting. We're on average in the urgent care virtual video practice, we had 23 on a daily basis in 2019, and we bumped that up to over 400 every day. So that was a 16% bump up. But when you add in all of the service lines, virtual video practices that we stood up, we went from the same day average of 23 visits to now averaging about 1,800 per day, which is a 7,500% increase in the system-wide video visits. And that doesn't include the virtual check-ins and the phone visits, which are even higher, and the e-visits, as well as the e-consults. So really a lot of things happening in terms of just the bump up in virtual health. One of the things that we did early on was we quickly stood up an AI-powered chatbot in our website, in our digital front door, so our apps and all of that. And whereas in the first 24 hours of this, we had about 30,000 unique visitors, it has continued to rise up, and you can see close to about 700,000 chatbot users cumulative, and about 800,000 there in terms of cumulative sessions. It continues to rise up, which is just tremendous. And it was really helpful in allaying fears, but also helping with the triaging of our patients. And so capabilities such as these chatbot type solutions will not go away, and they'll continue to stay even moving forward. So how do you lead through a crisis? And when we think about strategy for a system as large as ours, I wanted to share with you some of our leadership fundamentals. And I think, one thing that I subscribe to is the fact that leadership is less about putting certainty out there, because in healthcare in particular, especially at a time like this, you cannot guarantee certainty. So it's less about certainty, but it's more about clarity. And I think clarity really is king. And so these are some of the leadership attributes that we strive for here at Atrium Health, and I think is really important. So humility, empathy, science, agility, resiliency, so really critical. So, we obviously as a healthcare community did everything that we can, and you in California have been really leading the charge in a lot of the different ways to flatten the curve and to stop this sort of the death march that was coming at us from a national perspective. But just from a strategy perspective, so we think about, how do we pivot? How do we think about what's next? I wanted to break it down into three specific categories here. There's the financial elements, there's the access elements, and there's the operational elements. And this is essentially how we're thinking through. Financially, we as a health system are, like many other provider organizations, going through a lot of losses right now, and we're reevaluating a lot of our capitalization ratios and all of that. At Atrium Health, it's about $150 million of losses every month that we're going through this. So that's pretty dramatic given where we were previously. From an access perspective, we talked about virtual, digital health solutions will continue to be prioritized over anything else. One big strategy that we're pushing for here at Atrium Health that I'm working on right now is what we're calling our Connected Care Everywhere strategy. And that's essentially, in a nutshell, trying to put together a number of strategies that say, hey, what does care outside of the bricks and mortar hospitals really look like? And I think that's going to be really important post-COVID-19. And then from an operations perspective, work from home is now a reality, and we've essentially mandated that those of our teammates that can work from home should work from home at least until the end of the summer, and it'll probably continue at least until the end of the year, and perhaps that'll be the new norm, and we might continue to do that well into the next year. And so lots of things from an operational perspective as well. So I won't go into too much of the details. But what I did want to share with you is that I think what we're dealing with right now is really just that first wave. And there's going to be a first wave tail of the post-ICU recovery, a second wave of the impact of resource restrictions on urgent non-COVID conditions, because they didn't just suddenly disappear. So they're going to be coming back, and we're starting to see some of that now that we're starting to reopen some of our facilities and the electives from a selective perspective. And then this third wave of impact of interrupted care of chronic conditions, and perhaps a fourth wave of mental illness and economic injury and burnout that we're going to see the sustained over time. So a lot of things there from a strategy perspective, but the one thing that we did put in place was this framework where we immediately mobilized a war room, and we had a number of different parameters that we set up so that we could be a lot more nimble of an organization. And in many ways, decisions that took years sometimes to make were made within days, and that was really remarkable. So I'll quickly go through some three examples. One is our virtual hospital that we stood up in a very short period of time. And what was really interesting about this was at the peak of our pandemic, we were able to stand this up just within a matter of a day and a half. And that was, I think, quite remarkable. Over 1,500 patients have received care in the virtual hospital since the opening in March 24th. And to support patients in their home environments 24/7, which was the goal out of the virtual hospital, so we could keep patients that did not need to come into our ICUs and into our hospital beds, we could keep them at their homes, right, and monitor them digitally. And that was essentially the goal of our virtual hospitals. And this is sort of a coordinated effort across so many different areas at Atrium Health. And essentially what we did was we were able to then have 2 virtual floors, each staffed with care teams that included physicians and APPs and nurses and PharmDs and social workers and paramedics. And it was quite remarkable. And here's what we did across the 2 floors was we had the first floor essentially dedicated to patients with limited symptoms, not requiring inpatient care. And then the second floor, you can see my air quotes here, were patients that required inpatient level care, but not necessarily critical enough to be admitted into the ICU, where again, we're monitoring them remotely with their oxygen saturation and blood pressure and temperature and a number of other parameters. digitally. And that care management navigation across the continuum was what we were managing on a day in, day out basis. So it was really helpful. The results were remarkable for us, and we're able to really manage our bed capacity very effectively from this. And I think this is here to stay. I think what we're going to do is continue to push this forward and imagine the next big hospital for Atrium Health to be a 1,000 or a 10,000 bed hospital that essentially are patients' homes and the beds that exist in their hospital. So monitoring them remotely, leveraging digital and population health fundamentals to really risk stratify our populations, but manage them where they eat, work, live, and play will continue to be a strategy that we'll continue to push ahead with. Very quickly, a couple of words on point-of-care ultrasound. So this was really interesting. I'm a radiologist, so we've been proudly social distancing since 1895, is what I like to say. So it wasn't difficult for radiologists when social distancing became a norm for us almost. But joking aside, what point-of-care ultrasound is essentially this, right? So it's a probe that's connected to your iPhone. And we're the first major health system to go live with this in an enterprise manner, and we're able to turn this on in the last couple of weeks, and it's been really beneficial. The three things that I've always been pushing for around POCUS or point-of-care ultrasound is size. I wanted for these devices to be portable and really a part of a smartphone. So the many times that I was trialing out portable ultrasounds in the last several years, the size was too big. Price point, oftentimes 10,000, 20,000. I wanted these to be less than 2,000, which is what these devices are. And I wanted AI to be present because these are not just being utilized by radiologists. In fact, it's primarily being utilized by ED physicians, cardiologists, our anesthesiologists, our paramedics, nurses, and others in the front line as well. So this is AI powered in many ways. So it's quite remarkable. So it had all three of those specific elements. Here's a patient being scanned with all of the PPE. So we're able to look at things like pleural effusion, lung opacities, lung consolidation, pulmonary edema, and this is really the portability of it was what really brought to bear the benefits, and then the ease of cleaning, and then obviously the throughput, so that we could quickly move our patients, COVID positive or otherwise, through our EDs, ICUs, and pop-up clinics.
This is a lung ultrasound study in a patient with confirmed COVID-19 infection. We're in a lung preset. We see a rib here with a shadow.
I'm going to skip to the next slide here. That was just an ultrasound, a lung ultrasound that I've done on a patient here. So lots of positive feedback, both from the front line as well as, again, this is a strategy that we're going to continue to expand across the enterprise here. And I truly believe that point-of-care ultrasound will be the new stethoscope. And we'll have a lot of different use cases. We're going to actually build out a new medical school here in Charlotte soon, and in the white coat ceremonies, I'd like to give out these POCUS devices to all our medical students. So lots of amazing things coming yet. I'm going to end with just a couple of slides in terms of how we're managing communications and some of our community benefits. This is a quote from Mary Curie. She said, "Nothing in life is to be feared, it is only to be understood." And I think at a time like this, this is really important, and communication can be your Achilles heel, or it can also be your biggest ally. And one of the things that we've been able to do in the last year that I've been here is really align our communications group with our data and analytics group with strategy. And so we do a lot of studies in terms of what are our consumers saying, right? So design thinking exercises, but really also specific surveys and studies. And we found that there were a lot of concerns about the economic consequences, about, is there enough testing being done, and are there enough ventilators and tests? And so a lot of things there. One of the things that we decided to do some weeks back as we were planning for the reopening was we said we're going to put a number of things together around what we're now branding as COVID safe. And this is a visible badge that's available in our digital elements as well as in our physical footprint. And it provides a level of reassurance, which I think is what our patients and our communities really need right now. And behind this badge are a number of things that we're doing in terms of some of the things that I've outlined here and more. that provide reassurance to our patients and our communities that we're doing the right thing. So as we're opening up our facilities, and as we look at some of the sort of the long tail of the pandemic in the next year or more, as we await the vaccine and perhaps the herd immunity elements, I think things like the COVID Safe initiative is going to be really important. We're continuing to obviously spread the message, both regionally as well as nationally and beyond. So a lot of our clinicians and our leaders continuing to spread the good word. And we're doing a lot of things internally as well, right? So I think that's important as well with 70,000 teammates. So using apps and digital platforms to really spread the word internally and make sure that we're able to communicate. And then from a regional perspective across our communities, doing a lot of things there, whether it's around the remdesivir trial that we're leading, the number of things that we're doing to serve the underserved and the minority communities here across the Southeast. So there you see these buses that are going around, work that we're doing with the YMCA. And we're leveraging fairly fancy analytics and geo-mapping and geolocation, GIS technologies to look at these hotspots and essentially send these buses and serve the communities with COVID-19 testing and more. And then a number of things that we're doing around antibody testing and such. So a lot going on, but I'm going to stop there and then hand it over to Anish, because at the end of the day, it is really about not just what's happening in health systems, but also at a national level. And I don't see anyone better than Anish Chopra to give us insights into all of that. So Anish, all yours.
It was amazing. Thank you.